April 1st, 2020. Guys, there's so much to talk about. I don't even have time to get into it all. And I've been wanting to do a video about non-steroidal anti-inflammatories because in many of my videos you hear me say, don't suppress the fever. Do not use antipyretics. Don't go using analgesics. You know, that pain is an indicator to you that you're not ready to take on the level of activity that you want to do. So as much as it sucks, take that pain, deal with it. Be sick. Deal with the fever. Deal with the mucus production. All of those things. Deal with the inflammation. All of these things serve a purpose. So we're going to talk about Tylenol today. But before we get into that, I just want to talk a little bit about current events and what's going on. There are so many agendas being fulfilled with this right now. There are laws being slipped into these financial aid bills. I mentioned 5G, some legal language around 5G being pushed through to boost protection and safety. Guys, everything is going to be covered under the umbrella of this is for your protection and safety. And all it is doing is stripping away our civil liberties. Okay, we have no freedom right now. We're being taught in our mind that we're weak and we're fragile and we need medicine and we need the government to save us. And we're going to die if we don't have their help. And we're in a war with an invisible enemy. Everything is about war. Okay, 9/11 was about terror, creating fear, and we were so scared, we said, yes, surveil us, do whatever you need to do. And this is the same thing. We're so scared, we're saying, yes, lock us down, keep us safe, do what you needed to do. And we're just buying into this narrative of lies. I keep adding videos. All of my playlists on the Fear vs. Freedom channel are living playlists. I'm constantly adding to all of them. But if you haven't started watching the medical martial law pandemic prophets, please keep up with it. Dr. Rashid Buttar is doing some great work on tracking the lies medically that's going on with this. He goes through the studies in detail, proving how this was engineered and patented and created over the past few decades until it got perfected in November 2019 and then, of course, released. And now the reporting by the media is being sensationalized and manipulated. And the numbers do not add up. And whistleblowers are coming out. Medical professionals are saying, hey, look, we have patients that are dying of natural causes. We go home and the next day we come back and the cause of death states coronavirus, and that's not what happened. So you can't trust the numbers. You can't trust the media. You can't trust the cure or the medical intervention. It will destroy you or give you some level of susceptibility to further harm in the future. Look, trust your divine design, please. So what are some of the agendas being fulfilled here? Well, there's a bill slipped in there that's going to remove the right to own an assault rifle. And I know many people that own these type of guns, semi-automatic weapons that it's for their, either they like it, it's a hobby, it's a passion, or it's for their protection. Guys, it's our right as Americans to have these. And again, they are pushing the technocracy agenda heavily. While all society is on lockdown and everybody's in their homes, they're out there installing these 5G towers like mad. They're going up all over the place, everywhere. And this is going to be launched all over the world. They're being installed at the schools right now while the schools are shut down. They're being put up everywhere. And we are going to be bombarded with these frequencies that are going to destroy our DNA. They're causing cancer. They're causing all kinds of cancers directly to our heart and brain and all kinds of essential functioning organs. Well, there all are. You're not born with any organ that you don't need, so stop removing them. And surveillance. They're going to be able to surveil every move we make. And if you don't think they're already doing it, you're wrong. I've got an article here just right here in Colorado where they say Colorado is tracking your location via your cell phone. This is how they're seeing if you're doing as you're told. Are you staying home because we told you to? Are you afraid of this because we told you to be? Right? Look, from our governor, we're looking at different data that is available. Metadata, which means data through data partners like your cell phone companies. We're watching how people are moving around with their cell phones and how much they're moving when people are pinged. Real-time traffic data from the Department of Transportation. We are being surveilled to see how much we obey the authority or not. And don't think they're just using metadata. They've got it down to each individual. And if you are picking up on this and you're leaving your cell phone home or you're not logging into certain things, guess what? Doesn't matter. Microchips are just minutes away. Look, there's a lot of great reporting out there done by independent journalists. The Last American Vagabond is great. Rashid Buttar is great. The High Wire by Del Bigtree is great. One of my favorites is James Corbett, and he has been doing decades of research. And you can go, I have the They Who playlist on my Fear versus Freedom channel where you can see how this has been going on for centuries, really. And it just keeps progressing. And we are heading into the technocracy. We are going to be controlled and surveilled 100% of the time. And if you don't care, you're really not paying attention. This is a big deal. Also, they're telling you that you shouldn't ever congregate in large groupings of people, right? You can't be with a group more of 10 people. Well, great, then we can't have anybody around us because in my family, plus our foster kids, that's 10 right there. So why not have large groups of people? Well, what are some of the big things that were happening in large groups in 2019 and 2020? Well, here's just a few, right? The Hong Kong protests. This had been going on for quite a long time. People are waking up to the corruption in leadership all over the world. Okay, so you had the Hong Kong protests. You had the Yellow Vest protests in France. The citizens of France this has been going on for many, many, many months against the corruption of Macron over there. Ecuador, uprising going on in Ecuador, in Venezuela. What about in America? And all over the world, in Italy too. People waking up to the corruption of medicine and vaccination and protests going on and on and on. So you have, all over the world, mass gatherings that are powerful and a threat to those in power. And how did they shut it all down all at once? Pandemic. Done. No more groups. No more gatherings. No more voices crying for their rights that we all deserve. It's done. It's shut down. You can't even go visit your family. Oh, don't worry. Just launch a Zoom and virtually get together. Virtually do this. Virtually go to work. Virtually do this. This is all part of that technocracy agenda. And if you don't know what I'm talking about, start doing your research. It's very dangerous. Okay. My goodness. Let me go on to Tylenol. Now, I wish I had time to make, slides with bullet points to just hit the key things that matter. Because the number one piece of feedback I get from, unfortunately, everybody that watches, not everybody, the people that I try to push my content to, they go, oh, I started watching it, but it was just way too long. I don't have the time. I don't want to, it's just too long. Well, it is what it is, because the devil is in the details, and I'm barely touching the tip of the iceberg and saying, you need to go look at more. Okay, my hour video should lead you to days, weeks, and months of research. Let's talk about Tylenol. Guys, if you have any of this stuff, any non-steroidal anti-inflammatory drugs, but especially Tylenol, in your medicine cabinet, get it out of your home right away. Seriously. Raise of hands or in the comments, how many of you received or have given Tylenol in your family? Me. I regrettably raise my hand that all of my children received this as an infant and throughout adolescence into adulthood. And let's look at why I hate what I did. So just Googling some of the side effects, right? Tylenol, also known as acetaminophen, Paracetamol. There's a lot of different names. It's an analgesic, pain reliever, an antipyretic, fever reducer. We've talked about this before. Used to treat pain. So what are some of the side effects? Well, nausea, stomach pain, loss of appetite, itching, rash, headache, dark urine, clay-colored stools, and jaundice. Okay? Jaundice, yellowing of the skin or eyes. Interesting that they don't actually say, well, what is that? Why do people get jaundice? That is liver failure, guys. Liver damage. It's a big deal. They try to make it sound like, oh, it's not a big deal. These are just some side effects, but it's worth it to get that pain relief or the fever reducing the fever. Oh, get medical help right away if you get a severe rash, itching and swelling, especially the face, tongue, and throat, severe dizziness, or if you have trouble breathing. Then there's cause for concern. Oh, and what about contraindications with existing medications? Well, it interacts with literally everything. Antibiotics, antifungals, sulfa drugs, tuberculosis medications, birth control pills, hormone replacement therapy, blood pressure medications, cancer medications, cholesterol-lowering drugs, gout, arthritis medications, HIV/AIDS medications, medicines to treat psychiatric disorders, non-steroidal, anti-inflammatory drugs, so taking it stacked with ibuprofen and aspirin and other drugs, which you're told to do by your doctor, and seizure medications. Make sure you talk to your doctor if you're doing any of these things, and if you're pregnant. Let's keep scrolling down. In rare cases, Tylenol may cause severe skin reaction that can be fatal. This could occur even if you've taken Tylenol in the past and had no reaction. Stop taking this medicine and call your doctor right away if you have skin redness or a rash that spreads and causes blistering and peeling. If you have any type of reaction, you should never again take any medicine that contains acetaminophen, which is like 1 million. Stop taking acetaminophen and call your doctor at once if you have loss of appetite, stomach pain, especially on the upper right side, tiredness, itching, dark urine, clay-colored stool, and jaundice. Again, they don't dive into the details. So here's what we're finding if you're Googling this and just trying to see what are some of the side effects of Tylenol, paracetamol, acetaminophen, all the same. Well, what am I not seeing here? Let me tell you, there's a lot more to this than they're even acknowledging here. What about ADHD? How many of you know somebody in your own family or friends in your neighborhood who have children or adults facing challenges with ADHD? I know many. Autism spectrum disorder. Raise of hands. How many of you know kids with autism? I know dozens. And a lot of them are tied to the epileptic community. And a lot of them aren't. What else does it do? It blocks your ability to make glutathione, one of the most important endogenous antioxidants that you need to fight disease and reactive oxygen species that cause oxidative stress in your body. Very important. What about collagen production? or the deterioration of your muscular skeleton system. Big deals here. So, you guys don't want to dive into all the details and take an hour, but let me just point you to some studies, and then you can go read through them if you want. I'll just hit on the abstracts if possible, but I love to talk. Okay, how come nobody knows about this? Here's a great study, March 4th, 2020. Public awareness of Tylenol and risks of drug-induced liver injury. Results of a large outpatient clinic survey. So this is a huge survey. And basically, again, let's just jump to the details. These patients, overall, in large, which means just about everybody, well-educated cohort of patients, knowledge about the adverse effects of Tylenol, as well as the additional risks with alcohol consumption of various retailed products, was suboptimal. Oh, that means nobody knew how dangerous Tylenol actually is. We speculate that consumer ignorance is a significant reason why acetaminophen, Tylenol, is a leading cause of acute liver failure. And you can go read through all the details of this one. But basically, bottom line, people don't know shit about the dangers of Tylenol, including doctors, and they don't care. All right, moving on. Another study published 2017, March. The role of oxidative stress, inflammation, and Tylenol exposure from birth to early childhood in the induction of autism. The wide range of factors associated with the induction of autism is invariably linked with either inflammation or oxidative stress, and sometimes both. The use of Tylenol in babies and young children may be much more strongly associated with autism than its use during pregnancy, perhaps because of well-known deficiencies in the metabolic breakdown of pharmaceuticals during early development. Thus, one explanation for the increased prevalence of autism is that increased exposure to Tylenol. Exacerbated by inflammation and oxidative stress is neurotoxic in babies and small children. This view mandates extreme urgency in probing the long-term effects of acetaminophen use in babies and the possibility that many cases of infantile autism may actually be induced by Tylenol exposure shortly after birth. Infant Tylenol exposure shortly after birth. Go through and read this, guys. What causes oxidative stress and inflammation? You better believe every time that baby's vaccinated, they're getting huge amounts of oxidative stress and inflammation, not just throughout the body, but in the brain. These aluminum deposits that go all throughout all of your organs, including the brain, are causing massive levels of oxidative stress and inflammation. And what do the doctors tell you as soon as your baby gets their shots? Oh, just give them some Tylenol. Give them some infant Tylenol, and then 4 hours later you can follow it up with ibuprofen. Thanks, doctor. You just contributed to the autism epidemic. And this is the advice you give every one of your patients. Another study, October 2019. Association of cord plasma biomarkers of in utero acetaminophen exposure with risk of ADHD and autism spectrum disorder in childhood. Prior studies have raised concern about maternal acetaminophen use during pregnancy and increased risk of ADHD and ASD in their children. Objective, to examine the prospective association between cord plasma, Tylenol metabolites, and physician-diagnosed ADHD, autism, and both combined ADHD with autism, as well as other developmental disabilities in childhood. Conclusion, cord biomarkers of fetal exposure to Tylenol were associated with significantly increased risk of childhood ADHD and autism in a dose-response fashion. Our findings support previous studies regarding the association between prenatal and perinatal acetaminophen exposure and childhood neurodevelopmental risk and warrants additional investigations. Bottom line, huge association. We are causing these neurological diseases by doctors promoting the use of Tylenol in infancy and early childhood and in pregnancy. Look, I have many family members who either recently had a baby or are pregnant right now, and every one of them have doctors saying, take Tylenol. Oh, you're uncomfortable, you're not feeling good, take some Tylenol. Fudge, dude. Do you guys even read? NIH-funded study suggests acetaminophen exposure in pregnancy is linked to the risk of ADHD and autism. This is actually the exact same study, but just dives into it a little bit more. So the researchers classified the amount of Tylenol and its byproducts in the samples into thirds, from the lowest to highest. Now, compared to the lowest third, the middle third of exposure was associated with 2.2 times risk of ADHD. The highest third of exposure was associated with 2.86 times the risk, and similarly, autism risk was higher for those in the middle by 2.14 times, and highest third 3.62 times more likely to have autism than those that were in the low dose Tylenol. So it causes autism. There's a causal relationship. May 2018. Acetaminophen, antibiotics, ear infections, and breastfeeding, vitamin D drops, and autism. An epidemiological study. Background. While many studies have examined environmental risk factors for autism, much of the research focus has been on prenatal and perinatal factors. Yet, the postnatal environment may affect the risk of autism as well. No shit. To determine whether a set of 5 postnatal variables are associated with autism, these variables are acetaminophen exposure, antibiotic exposure, incidence of ear infection, decreased duration of breastfeeding, and decreased consumption of oral vitamin D drops. Look, if you're breastfeeding, you're getting the right amount of vitamin D that God intended for the baby. Okay? Don't stop breastfeeding early. Don't introduce solids too early. That affects the gut microbiome. Look it up. Okay, results. Well, let's go just jump to the conclusion. You guys can go read through this. This study adds to evidence that postnatal Tylenol use, postnatal antibiotic use, incidence of ear infection, and early weaning of breastfeeding are associated with the increased risk of autism. It also finds that postnatal oral vitamin D drops are weakly associated with autism when adjusted for breastfeeding and demographics, right? So doesn't matter. If you're doing the breastfeeding, you don't need them. But what's with these increased ear infections? I'll tell you. Go look up the research on invasive bacterial vaccines, specifically Haemophilus influenza B. Those that use that vaccine have much higher rates of ear infection, strep throat, sinus infection. We're causing these problems as non-specific effects from the vaccinations. Great one to look up is the CalJam presentation, 2018 CalJam from Dr. Suzanne Humphreys about invasive bacterial vaccines. And you'll see a direct correlation with all these ear infections and strep throat and all these increased infections and antibiotic use because of the vaccines. Tylenol, Vaccination, match made in hell. January 2020. Postnatal, acetaminophen and potential risk of autism spectrum disorder among males. Abstract. Some evidence from the literature suggests that postnatal Tylenol exposure may be associated with increased risk of autism spectrum disorder. Using a dataset obtained from previous study that was derived from an internet-based survey among parents of over 1,500 children from the U.S., an adjusted odds ratio, the AOR, and gender-specific AORs for doses of postnatal Tylenol provided before age 2 were calculated against the outcomes of autism. Separately, perinatal uncertainty on the numbers of doses of Tylenol provided was analyzed. The population attributable fraction associated with postnatal Tylenol exposure before age 2 for autism among males was also estimated. Postnatal Tylenol exposure measured in doses before age 2 was found to be associated with ASD among male children, aka there is a causal link. Of course, the results suggest the possibility that postnatal Tylenol may be a significant contributor to the risk of autism among males in the U.S. Stop using drugs. Did Tylenol provoke the autism epidemic? Guys, this was presented back in 2009. Back in 2008, Schultz raised the question whether regression into autism is triggered not by the MMR, but by Tylenol given for its fever and pain. Considerable evidence supports this contention, most notably the exponential rise in the incidence of autism since 1980 when Tylenol began to replace aspirin for infants and young children. The impetus for this shift in a Centers of Disease Control and Prevention warning that aspirin was associated with Ray's syndrome, which has since been compellingly debunked. So now they're just saying, well, instead of Tylenol, let's go back to aspirin. Stop using drugs. Stop vaccinating. One moment. Okay, I'm back. Okay, no, don't replace it. Stop injecting your kids with poison, and then you don't need these stupid pain relievers and fever reducers. That fever has a purpose. Let it ride. Whew. Acute liver failure. Acute liver failure. Do you realize Tylenol, acetaminophen, Paracetamol, I don't care what you call it, it is the number one contributor to acute liver failure. Wasn't on the side effects thing, it's just a jaundice. Tylenol is a well-known pain reliever and fever reducer drug. It is considered to be safe when administered within therapeutic range. My eye. But in cases of acute intoxication, hepatotoxicity can occur. That's liver damage. Tylenol overdose is the leading cause of acute liver failure in the northern hemisphere. Historically, studies on Tylenol toxicity have been focused on the liver, with alterations in the brain function attributed to secondary effects of acute liver failure. So we've known for a long time that it causes acute liver failure. And then the neurological damage that's happening, we used to hypothesize that it was happening as a secondary effect to the liver damage. Nope. In the last decade, the pharmacological mechanisms of Tylenol as a cannabinoid system modulator has been documented, and some articles have reported in situ that the original toxicity by Tylenol in the brain tissue is from the Tylenol at high doses. Paradoxically, low doses of Tylenol have been reported to produce the opposite neuroprotective effect. Look, they always have to build up this treatment no matter what. Okay, any study that's going to talk about the non-specific damaging effects of vaccines has to begin with vaccines are the greatest thing that ever happened to the world. But yes, they do cause type 1 diabetes and encephalitis and epilepsy and autism and all these other things. But we're going to try to find why the genetic disposition is there so we can just inject everybody. Read through these studies and pick apart the bullcrap. It's not good for you. That one was from 2016. All right. Another one from July of 2016. Tylenol's dose-dependent drug hepatotoxicity and acute liver failure in patients. Drug-induced liver injury is rare but serious clinical problem. A number of drugs can cause severe liver injury and acute liver failure. Acute liver failure at therapeutic doses is in a very limited number of patients. The idiosyncratic, which is currently not predictable in preclinical safety studies, appears to depend on individual susceptibility and the inability to adapt to the cellular stress caused by a particular drug. So they're saying at therapeutic doses, yes, it has caused some serious damage to people, but we don't know how or why or who's susceptible to it, so go ahead and take it anyway. In striking contrast to idiopathic, drugs with dose-dependent hepatotoxicity are mostly detected during preclinical studies and do not reach the market. One notable exception is Tylenol, which is a safe drug at therapeutic doses but can cause liver injury and acute liver failure after both intentional and unintentional overdoses. The challenges related to Tylenol toxicity are to better understand the mechanisms of cell death in order to limit liver injury and prevent acute liver failure, and to develop biomarkers that better predict as early as possible who is at risk for developing acute liver failure with poor outcome. Or, better yet, don't take the crap. And just a minute, I don't think I need to pause it right now. Just give me 1 second, please. What's this one? Oh, I should have stayed where I was because I had it in the spot I wanted. Okay, let me just pause this so I'm not wasting your time. All right, sorry about that. Now this one, I'm going to encourage you to go read on your own. It's way too in-depth to get into in this video, but it's called Mechanisms of Inflammatory Liver Injury and Drug-Induced Hepatotoxicity. I've been saying it wrong. Hepatotoxicity. This article provides a brief overview of the mechanisms of inflammatory liver injury and how this applies to drug hepatotoxicity, with a particular emphasis on the role of inflammation in acetaminophen-induced liver injury. It really goes into depth about cell necrosis, cell regeneration, the mitochondria, the P450 enzymes in different channels, and how Tylenol is disrupting all of this. Right? Tylenol is suppressing a lot of the macrophage and different things that come and clean up the necrotic cells, prevent the regeneration of new cells, and is causing all kinds of problems because we are always trying to block inflammation when it actually serves a purpose. So you can go and read through this one. It's very in-depth. It's a good read. It gets pretty complex, but it's really important. June of 2018. Okay, evidence the U.S. autism epidemic initiated by Tylenol is aggravated by oral antibiotics and now exponentially by the herbicide glyphosate. So now we're being attacked from all angles. Medicine, vaccination, antibiotics, and now our food, our freaking food, because it's soaked with glyphosate, with Roundup. The genetically modified foods are sprayed with Roundup all year long. The wheat is sprayed with Roundup as a desiccant before harvest to increase yields and speed up harvest. So are the oats. So just about every food you eat has toxic levels of glyphosate, and this talks about how the combination is destroying our children. Because certain hereditary diseases show autistic behavior and autism often runs in families, researchers seek genes underlying the pathophysiology of autism. That's right. It's never the issue, it's the genes. Your kid's the problem. Well, what's causing that gene expression? You know. Other research argue environmental factors are decisive, citing compelling evidence of an autism epidemic in the United States beginning about 1980. Recognition that environmental factors influence gene expression led to synthesis of these views, an epigenetic epidemic provoked by pervasive environmental agents altering expression of vulnerable genes, inducing characteristic autistic biochemistries in many mothers and infants. Two toxins most implicated in the U.S. autism epidemic are analgesic antipyretic acetaminophen, Tylenol, and oral antibiotics like amoxicillin or clavulanate augmentin. Recently, herbicide glyphosate or Roundup was exponentially implicated. What do these toxins have in common? Tylenol depletes sulfate and glutathione, which I already mentioned. You need that. Required to detoxify it. Oral antibiotics kill, and glyphosate inhibits intestinal bacteria that synthesize methionine, which is a precursor of sulfate and glutathione, and required to methylate DNA. The bacteria that synthesize tryptophan destroyed, which is a sole precursor of the neuroinhibitor serotonin, and bacteria that restrain ammonia-generating anaerobes. Sulfate plus glutathione, normally sulfate fetal adrenal androgen dehydropyandrosterone, major precursor of placental and postnatal estrogens. Glyphosate and heavy metals also inhibit aromatase that turns androgens to estrogens. Placental and postnatal estrogens dehydrate, mature the brain, the myelin sheaths, mature corpus callosum, and left hemisphere preferentially, dilate brain blood vessels, and elevate brain serotonin and oxytocin. Stress-induced weak androgens and estrogen depletion coherently explain white matter asymmetry and disconnection in autism, extreme male brain, low brain blood flow, hyperexcitability, social anxiety, and insufficient maternal oxytocin at birth to limit fetal brain chloride, water, and mature GABA. Holy crap. So many poisons in our world that are destroying our children and ourselves. And do we give a crap? No, we'd rather live blissfully ignorant and yet sick all the time. Paracetamol in fever in critically ill patients. Just going to jump down a bit. Treatments to reduce fever include the use of antipyretics. Thus, the reduction of fever might reduce the ability to develop an efficient host response. It's suppressing your immune system, your innate response. This balance between harms and benefits has to be taken into account every time we decide to treat or not to treat the fever in a given patient. Among fever reducers, paracetamol, Tylenol, guys, is one of the most common used. Tylenol is a synthetic, non-opioid, centrally acting analgesic and antipyretic drug. Its antipyretic effect occurs because it inhibits cyclooxygenase 3 and prostaglandin synthesis within the central nervous system, resetting the hypothalamic heat regulation center. In this clinical review, we summarize the use of paracetamol as an antipyretic in critically ill patients. Bottom line, it's causing more problems than it's helping by reducing that fever. Back to liver injury. Risk factors of Tylenol-induced liver injury. Tylenol has been increasingly used for the treatment of cancer-related pain in Japan since the revision of the package insert on January 21, 2011. However, high-dose Tylenol may cause liver injury. No duh. The objectives of this study were to investigate the prevalence of the liver injury in patients receiving Tylenol and to identify the risk factors. They show the methods and findings. The final implications. The findings from the present observational single-center study suggest that serious liver disease before administration is an independent risk factor for acetaminophen-induced liver injury. So in this case, you already had to have pre-existing liver disease for the Tylenol to be a causal factor in the specific group that they looked at, taking it for cancer pain. Adult neurobehavioral alterations in male and female mice following the developmental exposure to Tylenol. Tylenol is widely used non-prescription drug with analgesic and antipyretic properties. Among pregnant women and young children, Tylenol is one of the most frequently used drugs and is considered the first choice treatment for pain and fever. Recent findings in both human and animal studies have shown association between Tylenol intake during brain development and adverse behavioral outcomes later in life. The present study was undertaken to investigate if the induction of these effects depend on the when the exposure occurs during critical period of brain development and if male and female mice are equally affected. Mice of both sexes were exposed to 2 doses of Tylenol on postnatal days 3, 10, 19. Spontaneous behavior when introduced to a new home environment was observed at age 2 months. We show that adverse effects on adult behavior and cognitive function occurred in both men and women, male and female mice exposed to Tylenol on postnatal days 3 and 10, but not 19. These neurodevelopmental time points in mice correspond to the beginning of the 3rd trimester of pregnancy and the time around birth in humans, supporting existing human data. Considering that Tylenol is the first choice treatment for pain and fever during pregnancy and early life, these results may be of great importance for future research and ultimately for clinical practice. They're telling you right there that doctors it's their number one go-to, always. For both pregnant women and babies, use Tylenol. Tylenol, Tylenol, Tylenol. You hear it all day long every day with this pandemic going on. Use Tylenol. And you're going to see here in a minute why that's a horrible idea. Of course, if you haven't watched my flu fever death video, we go into a lot of it there. But with this being specifically a respiratory virus, it goes even further. Acute liver failure in pregnancy. How much is pregnancy related? Well, guess what? Maybe 30%. Background. Acute liver failure. Characterized by sudden onset of coagulopathy and encephalopathy may occur during pregnancy, either as a pregnancy-associated etiology or as an unrelated and coincidental liver injury. The U.S. Acute Liver Failure Study Group, comprised of 33 tertiary care liver centers, has enrolled consecutive patients with acute liver failure or acute liver injury over 2 decades. The results. 35 of the 70 were considered pregnancy-associated, of whom nearly half were attributed to hemolysis, elevated liver enzymes, low platelets syndrome, and half to acute fatty liver of pregnancy. Although in some instances the distinction was unclear, virtually all of the pregnancy-associated liver disease had been delivered prior to hepatology referral, most by cesarean section. Tylenol toxicity accounted for 21, that's 60% of the remaining cases, with the remainder resulting from a variety of other causes, but not including viral hepatitis A through E. Only half of those with acute liver failure during pregnancy appeared to have pre-existing. The morbidity and mortality for mothers and fetus are strongly associated with the etiology of liver failure. Tylenol played a part. This one's pretty sad. So I'm going to just come back down to the discussion. But this is a case report of a girl in Canada who tried to commit suicide, taking a bunch of pills. The parents ran her to the hospital. They thought, let's see if it says it. They weren't sure what she took, and they said a couple drugs. And later, throughout all the tests and looking at some of the metabolites and everything that came back, they finally realized that it was Tylenol overdose. And her liver had failed. She had gone basically brain dead. She was on life support and about to die. And so let me just go back down to the discussion. Tylenol is the most common drug taken in overdose in pediatric and adult populations. Classically, clinical acetaminophen poisoning is described in 4 stages. In the first 12 to 24 hours after ingestion, patients present with nonspecific symptoms such as nausea, vomiting, abdominal pain. After 24 hours, hepatic injury becomes apparent with elevated liver transaminase concentrations. And then in the third stage, patients can progress to fulminant hepatic failure, defined by the presence of encephalopathy and or coagulopathy. Patients will receive liver transplant, recover, or die. Cerebral edema leading to cerebral herniation and ischemia and common cause of death. Anyway, they go through all of this and realize that her liver damage is just far too, and the brain, she was so brain dead after neurological examination that they're like, she's not a candidate for a liver transplant because there's too much brain damage at this point. And so the doctors were trying to push the family to take her off life support and let her go. And they refused. They said, no way. We still have family that need to come say goodbye. So they pushed it off for a couple of days. And they continued to give her NAC, N-acetylcysteine, which is what they use to combat this toxicity. And guess what? By the parents pushing back and not letting them let her go and die, she made a full recovery. So listen to your gut instinct. Okay, trust yourself and fight for your life and stay away from these drugs. Again, acetaminophen decreases intracellular glutathione levels and modulates cytokine production in human alveolar macrophages and top 2 pneumocytes. You can go read this, but basically it's blocking your ability to create glutathione, which is very important antioxidant. It's an endogenous antioxidant that we make. That ability is suppressed by Tylenol, and it affects this major cascade of things at the macrophage level, the mitochondrial level, interleukin 6 and 8 production. You can go through and read this. I'm trying to hurry for you guys. Analgesic drugs alter connective tissue remodeling and mechanical properties. This is blocking the ability to create collagen and repair in the body. Exercising individuals commonly consume analgesics, but these medications alter tendon and skeletal muscular connectivity tissue properties, possibly limiting a person from realizing the full benefit of exercise training. You can go through and read this. Talks about both Tylenol and ibuprofen and how they're just ruining your body's musculoskeletal system and ability to heal and build the tissue. Non-steroidal anti-inflammatory drug therapy effect on healing of bone, tendon, and enthesis. They're commonly used for the treatment of skeletal injuries. The ability of these drugs to reduce pain and inflammation is well established. However, the effects of these therapies on healing of skeletal injury is less defined. These drugs inhibit cyclooxygenase activity to reduce synthesis of prostaglandins, which are pro-inflammatory, lipid signaling molecules. Inhibition of cyclooxygenase activity can impact many physiological processes. The effects of these drugs therapies on healing of bones, tendons, and tendon-to-bone junction have been studied in animals and cell cultures, but not much in humans. Use of different non-steroidal anti-inflammatory drugs with different pharmacological properties, differences in dosing regimens, and differences in study models and outcomes measures have complicated comparisons between studies. In this review, we summarize the mechanisms by which bone, tendon, and enthesis healing occurs and describe the effects of the therapies on each of these processes. So it's blocking a lot of these natural functions that should be happening. Conclusion. These drugs are readily available over-the-counter medications that are commonly used or prescribed to manage pain and swelling associated with skeletal injuries. Despite this, the available experimental and clinical evidence indicates these therapies can impair bone fracture healing and tendon-to-bone healing. The effects on the bone and enthesis healing is likely affected by the drug used, the initiation, and duration of the therapy. For instance, ibuprofen had an apparent less deleterious effect on bone healing than rofecoxib in rabbits, which was attributed to shorter half-life of ibuprofen, producing daily periods when cyclooxygenase was not inhibited. Considerably less known how these affect tendon healing. In contrast to fractures, there may have been a bit of benefit there, but these conclusions are not without exception and the subject to other aspects of patients' health associated with impaired healing, such as advanced age, diabetes, smoking, so many co-factors here. Consequently, prescribing physicians' assessment of patient health, the type of injury, and injury severity must be weighed against the benefit and potential drawbacks of these non-steroidal anti-inflammatory drugs. Are you guys getting the picture yet? Are you starting to realize you're better off just dealing with that short-term pain or even chronic pain and finding a better way? CBD can help. Hell, THC can help. Just cleaning up your diet can help. Eliminating toxins out of your life, supporting your body's ability to produce the beneficial processes that are there. Let's just look at one more and call it a day. The acceleration of articular cartilage degeneration in osteoarthritis by non-steroidal anti-inflammatory drugs. So people with osteoarthritis are actually accelerating the cartilage deterioration or degeneration when they're taking their pain medications. These drugs are among the most commonly used drugs in the world for treatment of OA symptoms and are taken by 20 to 30% of elderly people in developed countries, probably more. Because of the potential for significant side effects of these medications on the liver, the stomach, the gastrointestinal tract, the heart, including death, treatment guidelines advise against their long-term use to treat osteoarthritis. One of the best documented but lesser known long-term side effects is their negative impact on articular cartilage. Go ahead and look this stuff up, guys. But the downsides of this crap far outweigh any benefit you're going to get, ever. Run from them. Throw them away. Never spend your money on them. Never give them to your loved ones. Ever. Ever. Don't do it. And this is just taking a few minutes to look up a few studies. It goes, I'm sure, far, far, far deeper. And if any of you guys want to add to it, put it in the comments, because I know there's more. And I know I've got people, subscribers that watch that know a hell of a lot more than I do. But I'm going to bring this to your attention because I know a lot of people dealing with autism, ADHD, arthritis, asthma. That's right. One of these in here, I forgot to go through it, talks about how it actually causes asthma, increases asthma morbidity. It goes on and on and on. So, I know that in so many videos I said, don't take these drugs, just let the fever ride or deal with the pain. But I never said exactly why. We kind of went over some of the whys in flu fever death, specific to suppressing the immune system, letting that fever do its job, letting it improve the immune system response. But it goes so far deeper than that. And I'm hoping you guys are starting to get the big picture here. Big picture. So, if you guys have this crap in your medicine cabinet, throw it out. The Tylenol, the ibuprofen. You want to dive into ibuprofen, all this stuff we're talking about, liver damage, Let's just move it over to the kidney. You're going to destroy your kidneys. You're going to destroy your gastrointestinal tract, your gut flora. There's so many things. Again, the glutathione production, the collagen production, it doesn't matter. They're both horrible for you. And the whole asthma thing, it actually causes problems, pulmonary issues. So why are they telling you to take Tylenol with coronavirus fever? Blows my mind. It's going to make it worse. All these deaths, first of all, this death count is no way accurate. Go do your research there. It's unreal, the lies that are being told to us. And second of all, the death rate is so high because of the intense medical interventions they're throwing at people. The antipyretics, the analgesics, the antivirals, the antibiotics, all at once in combination, just boom, 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 and people are dying left and right. It's no mystery. All right, guys. Here I go talking on and on and on again. But thank you for listening. And as usual, I love you guys. Bye-bye.